Hello and welcome to today's video. Have you ever heard of the term brain-eating amoeba? It sounds like something straight out of a horror movie, but it is real and it's known in medical science. So let's begin. What is the brain-eating amoeba? The scientific name for the brain-eating amoeba is Naegleria fowleri. It is a microscopic, single-celled organism that lives in warm fresh water and in soil. It is called brain-eating because once it enters the human body, it can attack the brain and cause a deadly infection. This infection is known as Primary Amoebic Meningoencephalitis, or PAM for short. Where is it found? Naegleria fowleri is most commonly found in warm freshwater lakes, ponds, and rivers, hot springs and geothermal water, poorly maintained swimming pools, warm water coming out from industries, even in soil and dust in some cases. The good news is it cannot live in salt water, so oceans are safe. How does it infect humans? Now here's the important part: the amoeba does not make you sick if you drink water containing it. The real danger is when contaminated water goes up the nose. For example, while swimming, diving, or even using tap water in a neti pot for nasal cleansing. Once the amoeba enters through the nose, it travels along the olfactory nerve, which connects the nose to the brain. From there, it reaches the brain and starts destroying brain tissue. This is why the infection is so dangerous. Symptoms of infection. The symptoms usually begin 1 to 9 days after exposure, with an average of about 5 days. At first, it looks very similar to meningitis. Severe headache, fever, nausea and vomiting, stiff neck. As the disease progresses, symptoms become more severe. Confusion and hallucinations, trouble balancing, seizures, sensitivity to light. Eventually, coma. Sadly, the infection moves very fast, and death often occurs within 5 to 12 days after symptoms start. How deadly is it? Unfortunately, Naegleria fowleri infection has a very high fatality rate, over 97%. Out of hundreds of reported cases worldwide, only a handful of people have survived. This is why awareness and prevention are so important. Diagnosis and treatment. Doctors usually suspect PAM when a patient shows meningitis-like symptoms and has a history of swimming in warm fresh water. The diagnosis is confirmed by testing cerebrospinal fluid under a microscope or with special molecular tests. Treatment is very challenging. Some drugs have been used, including amphotericin B, multifosine, rifampin, fluconazole, and azithromycin in combinations. A few people have survived when the infection was detected early and treated aggressively, sometimes along with cooling the body to protect the brain. But the best strategy remains prevention. How to protect yourself? Here are some simple steps to stay safe. 1. Avoid swimming in warm fresh water during hot weather, especially in lakes and rivers. 2. If you do swim, use nose clips or hold your nose shut to prevent water from going up your nose. 3. Avoid stirring up sediment in shallow warm waters where the amoeba may live. 4. Always make sure swimming pools and hot tubs are properly chlorinated and maintained. 5. When using a neti pot or nasal rinse, only use distilled, sterile, or previously boiled water, never straight from the tap. These precautions can greatly reduce the risk. Final thoughts. The brain-eating amoeba may sound terrifying, but remember, cases are extremely rare. Millions of people swim in fresh water every year, and only a very small number ever get infected. Still, because the infection is so serious, it's good to be aware and take preventive measures. With proper knowledge, we can stay safe and continue to enjoy swimming and water activities without unnecessary fear. Closing. Thank you for watching today's video. If you found this helpful, please give it a like, share it with your friends, and don't forget to subscribe for more health awareness content. Stay safe, stay informed, and take care of your health.